Good day, everyone. Thank you for being here today. And our guest today is Dr. Anita L. Swanson. And Anita Swanson is a music therapist. And I guess that we are going to learn a lot about what is music therapy. But first of all, Dr. Swanson, I would like to thank you so much to accept our invitation. Thank you for being here.
Thank you.
So, Dr. Swanson, you are the president of the World Federation of Music Therapy, which is a huge organization, and you are yourself a researcher. You are a music therapist, and I guess that you have trained a lot of music therapists. The first question that I have for you today is, what is the origin of your passion about music therapy? When did it start?
Well, I think I've always been passionate about music. Growing up, I would play music for myself, sit at the piano probably every evening and play. And that was just, I enjoyed doing it and it made me feel good. I think every music therapist says when they're asked, why did you become a music therapist? It's because they love music and they love helping people. And so that's really where it was. For me, I didn't actually hear about music therapy until I was probably a junior or senior in high school. And so at that time, you're kind of thinking about what you're going to do with your life, where, you're going to go to school, college, and what are you going to pursue? And at that time, I was thinking about going more into pharmacy, with the same idea of like helping people. I know it's very different than music therapy.
Very different.
Yeah. You help people. Yes, I'm very glad I did not do that. But I actually just ran across an article about music therapy in my high school library. And I thought, I hadn't heard of it before that article. And then I was like, wow, this is perfect. Where you can use music to help people. That's exactly what I want to do. And so then I just investigated it and found out the schools that had offered it and went from there. So.
Oh, right. So how come do we know so few about music therapy? Because first of all, my first question should have been, how can music help people? How can music help people that are suffering from some disease and disorder? It could seem surprising, but I think it's not. In fact, music helps a lot of people, but how does it work? What is the basic of that?
Well, there's lots of different avenues to answer that question. Obviously, I could, teach this in a couple of semesters of courses, but I'll give you a couple of avenues. One is the way that music affects the brain. So now that we're able to do more brain research and see what happens in the brain, we can see that this is happening. We know that music, when you're listening to it, you have a pleasurable response. Dopamine is released. So that's one thing. You have like that good feeling that comes with it. But also the way it affects the brain itself. And so that's what I use when I'm working with people who might have had a stroke or been in a car accident or something, and their brain has been damaged. Music can either work around that, like you can use a different part in your brain to facilitate whatever it is you want to do, speak or walk or, whatever. Or you can build the pathways again by using music and strengthening those pathways. So that's one way is that affects the brain in so many different areas. Like you can look online and see lots of different videos, how when you're listening to music, your brain lights up, all over, as opposed to just one little spot. So you're activating lots of parts of it. Another thing is that people have a strong emotional connection to music generally.
Right.
Yeah. So, and that's actually what we use. Primarily, we use music that people enjoy and that they like, because that's going to be the most beneficial for them. And like we can see this with people who have dementia. So if you're working with someone who has dementia and they may not be oriented to the actual time of day or who they're talking with, they don't remember these loved ones or what, but the music is stored in the brain in a different way. And so they have these memories connected to the music. And then when you play this music, it takes them back and they can remember and they can talk to you coherently about that. And that's really great when their loved ones are there, because then they can share this moment together of the person, being who they are, without being masked by the disease.
Right.
So Yeah, so it's like brain cognition, but also a really strong emotional connection and memories associated with it.
Would you say that the brain is hardwired for music? Because as far as even archaeology, anthropology, we can go back in time as far as we can find history of humankind, we can find music. I believe that the first musical instrument was the flute, right? And it was around 9,000 years. But what do you know about that? And how can you associate music with the hard, the way that the brain works?
So yes, music is found in every culture that exists on Earth. There's a man, Dr. Alan Merriam, back in 1968, wrote a book called The Anthropology of Music. And he had studied the different cultures, and he came up with 10 ways that music is used in every culture. You know, like communication, expression, emotional expression, physical movement, different things like that. So you know, we don't know why people have music, because it's, you think about it, it's like, do I actually need music in order to breathe, or you know, like that. Although music directly affects those things in your body, it can affect your heart rate and your respiration rate and all of those things. But is it a necessary human trait? That's a topic of debate, and it has essentially come down to, well, we have it, and there's some reason we have it, and so therefore it must be necessary for something, you know. And maybe it's what makes us human, I don't know.
I believe so. I
Yeah.
strongly believe so. I can remember one of my niece, and she, and you may debate on that as well. She said to me at, she was something like 16 years old, and she said, "Uncle, what art is it for?" And I thought it was a fantastic question, and I said to her, "Well, in the caveman, they were drawing on the walls, and they were drawing two types of drawings, right? They were drawing a real animal, and they were drawing dream animals. So I guess that music is the same thing. It is something that let express something that we have in our soul. Do you agree with this?"
Oh, definitely. Yeah. I mean, there's music can express things that we can't express otherwise, you know, and uh, it's helpful for sure. You know, there's not always the right words to express what you want to say. Music also allows people to say things that they wouldn't say normally in just regular conversation. But I think it's also about that connection too. So music connects people, and it brings people together, and it makes you feel like you're part of the collective whole. So if you're all listening to a song together, you feel more connected with someone. And that in itself can, you know, can say things that words can't say.
So that's why it has a therapeutic effect, right? Because maybe it helped us to reconnect with some area of the brain that were not connected, right? So you went to school, you've learned that, and you applied it in a clinical context, isn't it? So can you tell us stories about what you encounter? Example, the first time that you really saw the result of your therapeutic approach, and maybe tell us a little bit of what concretely you do with the patients. What type of patient, and what do you do, and your first contact with patients?
Yes, so I've seen a lot of different types of people over the course of my career. I started out in private practice mostly, and so I saw lots of different folks. However, where I was living at the time, there was a very high incidence of children with autism. And so that became my main avenue, I guess, of my work, just because there was so much need where I was living. And that was really fascinating to me, because that was at the time where autism hadn't exploded like it has now, you know, and we didn't know as much about it as we do now, of course. But I think the wonderful thing about being a music therapist, and probably other therapy therapists as well, is that you get to see people do incredible things, you know. And so I got to be the person who heard several children's first words after, you know, like autism, many times children will be speaking and then they lose their speech around age 2, you know, and they may not get the speech back again. But so I got to be the recipient of, you know, first words. And my favorite moment actually with that was when I was working at this place that had it was a room with an observation room. And so the parents could watch, you know, the sessions through the windows.
Right.
And so I came out of this boy had said, you know, he said 2 words to me. I don't even remember what it is right now, but he said 2 words, and his mom was watching, and I came out of the session and she came out of the observation booth and she was just bawling. Because she said, I haven't heard his voice, you know, for so long. And that's the first time I heard it, you know. It's just like, wow.
Wow.
It was so incredible. Yeah, it's really fantastic.
That's a big
You know,
achievement.
Yeah. Yeah. And so then I get it also, you know, when parents.
What did you feel about that? I must have felt very great about that, isn't it?
Yeah, it feels really good. Yes, you know, and I feel so happy for them. And not only, I mean, the child, you know, is sometimes recognizes, wow, I did this really great thing, but many times, you know, they're just going about their life, you know, and they don't recognize how important that is, especially to the parents, you know. So it's really fantastic. Yes. And I see that, you know, I see that everywhere I go. I think really that with the families being available, and that's a really wonderful thing about music, is that people can participate in it. So yes, I'm doing music therapy for your loved one, but say, think about, like right now, I'm really working a lot in hospice. And so I'm working with the hospice patient, but the family's there too, and the family's benefiting from it as well. And they get to have those moments of interaction with their loved one that they have, you know, they have all these hours of taking care of them.
Elderly,
And then,
elderly people.
What was that?
Elderly people. Hospices is where the elderly people lives.
Yes, hospice is when people they're diagnosed to have 6 months or less to live. So they're dying. Yeah. And so there's a lot, you know, there's a lot associated with that. Families are starting to grieve before it happens. They have the extra work of taking care of them, you know. So, I mean, that's a really great thing. There's so many great things about music therapy, but that's one thing is
here you're not only healing the patient, but you're maybe also contribute to heal the whole family and the nearby people, the friends and all, right? Isn't it?
Oh yeah, definitely. Like when I go into hospitals, you know, I'm there to see the patient, but it also makes, you know, the nurses love it when we come in, because not only is the patient easier to work with after I've seen them or while I'm seeing them, but they got the benefit of hearing, you know, something happy in the hospital, you know? So, I mean, it's not always happy. It's not always happy music, but people, you know, like we said, people connect with music, and there's a reason why we have it in our lives. And so when you hear it, you respond to it. So.
Would you say that music, well, it's a packed question, but music can unblock some emotion that are blocked or that are stayed here and cannot be expressed, isn't it? And how does it work?
Oh, definitely. Yes. And in fact, when I was doing my master's degree, so all of my degrees are in music therapy. And when I was doing my master's, at one point I had thought about doing a double master's with counseling. And so I did that, and I started that. And then after a while, I thought, why am I doing this? I love music therapy. And for me, music therapy works really well. And music therapy gets to the emotions so much faster. And the reason why that is because music has direct impact on the limbic system. So if you know, as I know you know, but the limbic system is housed in the old brain. And that's where your emotions are. That's where your fight or flight response is. That's where your, what controls your heart rate and your respiration rate and all of those things. So even if you don't have higher cognitive thought, you can still be affected by music. And that's why we even work with people that are in comas. You know, if you're in a coma, you might have a lot of agitation and restlessness, even though you're not, you know, conscious to the world like we are right now. And so music can still affect you and help calm you down and make you feel more peaceful because of that ability to hit the limbic system directly.
Does it, do you believe that music can help them get out of the coma faster?
There was, you know, when I first started in school, there was some research into that. I don't think a whole lot of research has been done since then, but at that time they were starting to explore that. I can't say because I haven't worked with a lot of people in that situation, but I do know some people were talking about that. Yeah, you know, getting in on the rhythms. You think about music is so rhythmical, and as humans, we have so many rhythms within ourselves anyways.
Yes.
And that's actually rhythm is what helps us a lot of times. You know, when I was talking earlier about the people that are in a car accident or have a stroke and maybe they're learning to walk again, it's because of your in tune, innate rhythm that you're able to do that, that the music will help cue you to, you have to go with it. You know, your body just naturally responds to it. So.
Yes, because sometimes music can give you goosebumps, and it goes to, you know, it goes to so deep inside of you that it can affect so many things. Like it may have an impact on the lungs and the heart and on the limbic system, isn't it? Not only on the brain. I suspect that music has an impact on many other body parts, digestive system, because we know that stress can be located in the stomach area. Stress or fear can be located. I'm just assuming. I'm not a music therapist, but do you have any strong evidence of that?
Well, there's definitely evidence that music improves your immune response. So you become, you know, your immunity is raised.
Really?
But yeah, I fall into that same kind of camp, you know, where you're more healthy. You
Mm.
know, I do tell a lot of times when I'm working with my patients who have mental health issues, you know, I really encourage them to sing, because there are studies that say if you sing 10 minutes a day, it uh, reduces depression and reduces anxiety. So, and especially, you know, there's lots of studies out right now as far as music, singing in choirs, you know, but just even singing yourself, it releases that dopamine in your brain. It makes you feel better. When people feel better, you know, they generally take better care of themselves. You know, their body works more efficiently. Yeah. So yeah,
Yes.
definitely research into parts of that.
So yes, have you been using music for people that are near death and release their fear, release their emotions, and help them to pass? Have you used that, or have you been aware of that usage also?
Hmm. Yes. So yeah, sometimes people when they're dying, they are kind of holding on, you know, they're not ready to let go. So that, yes, you can help them. I mean, that's another great thing about music is that it affects you in so many different ways. It affects you physically, your body responses, like we've been talking about. It affects you emotionally, affects you mentally, affects you spiritually. So in all of those realms, it can definitely, it's very powerful, you know. And I see that with my hospice patients. Yes, oftentimes I'm using music therapy with hospice patients to reduce pain and reduce anxiety, but it could also be the
Pain,
emotional part. Hmm.
pain,
And
pain as well.
yes, yep, yeah. So their music, by using music therapy, you can reduce your use of other pain medications.
Really?
So, hmm,
Wow.
and that works. Yeah. So it's, you know, it's, you think about, oh, what I want to pay this music therapist to come in and do this, but you're, you know, you're saving money on medicine. You're saving, say you're working in a hospital situation, you know, like I said, it affects the nurses. It makes it a better environment. You know, we all have, I always, whenever I work in a hospital or when I have my students go in there to any type of facility, actually, I always tell my students, say, tell them to give you the hardest patients, the people that are the most difficult to work with,
Mm.
that they don't want to go in their room, you know.
Right.
um, and you work within, and you're going to see really good results. And you know, you will have a job. That's job security, because we can help these people feel better and get better, and that affects the whole environment, you know. So
Yes. And if they are able to take less medication, there is less side effect, and
right.
not only less cost, but less side effects. So I believe that it helped them a lot more, because sometimes not only side effect, but these chemicals can have long-term impact as well. So if you can, for example, anti-anxiolytics, you can become addicted to that, right? Isn't it? So
Right.
if
Yeah.
you can prevent having that in a psychiatric context with music, it's fantastic.
Hmm. For sure. Yeah.
Right. So music therapy is an official modality, right? This is something serious. There is science behind it, but there is also passion. And music therapy had to a little bit, I guess, fight in bracket to become recognized. Can you tell me a little bit about how this modality, how this technique had worked to become recognized around the world, not only United States, but around the world. What happened with that?
Yes, well, it's still developing, of course, in many countries. But in the US and Latin America, many parts of Latin America, Europe, Australia, it's fairly developed in those areas. There's research and there's university degrees in it. So yes, so to be a music therapist, you get a degree in music therapy, which you study music, of course, and you study psychology and you study anatomy and the ways music affects people, all the ways we've been talking, with their brain, their body, their mind, their emotions, all those things. And it's important to have that background, because a lot of times, we've been talking about how music makes people feel better, and it generally does, but because it's such a powerful force and because people have many things attached to it in their memories and in their emotions, it can also be very detrimental. So music can trigger something for someone, and then it makes it very real. So if we think about
fear.
Yeah. Yes. Yeah. Yeah. So this is a very not exaggerated example, but so for instance, I grew up in Minnesota, and in Minnesota, there's lots of deer, the animal, the deer. And we were driving one night and my brother was driving, and I remember listening to the song on the radio, and suddenly a deer hit our car.
Yeah.
And everyone was fine. Yeah, it was okay. The poor deer was not fine, but we were okay, but it's still startling, And so whenever I still hear that song, I think of that moment, because that is tied to that in my brain. So if you think about, I've worked with kids who have been abused and been in very traumatic situations. And you never know what music is going to be tied to that situation for them. For instance, I was working with this young adult, and the group wanted to sing, I don't know why, but at the moment we did a song like, I'd like to teach the world to sing. It wasn't quite that song, but it's something like that, where you would think that this is a safe song, that there's no strong emotions in it. It's just a very peaceful, happy song. And that song was tied to abuse for this person. And so we had to stop it, and I had to then take care of what was going on for him, because it had brought up this years of abuse. And so it shut him down, and all the psychological things that happen with that. And so that's why it's really important to be trained as a music therapist, because then you know what to do in those situations, and you know how music affects people, so you can see it. I think part of being a good music therapist is being a really good observer of people and of their behaviors and what's happening for them. So in the US, music therapy is recognized, but we're still working actually state by state to get licensure as music therapists, and to get insurance reimbursement and all of that. In other parts of the world, it's a little bit more tricky, because there aren't always university training programs in all the parts of the world. So for instance, some countries in Africa are developing music therapy training programs now. And if you think about, there's several cultures that have a very rich music healing tradition. So I think about Africa, I think about, there you go. To me, I hear a lot from people in India as well, and how do you bring the science to what they've been doing, and how do you differentiate music therapy from music healing? They are two different things,
Yes.
And so,
we had on one of our guests on our YouTube channel, sitarist, a lady that she's an Indian composer, and she is just amazing. She's Indian American, but she practiced sitar, and she is just unbelievable. But she could feel the therapeutic aspect of her composition, but she could not put words on it, because for her it was transcending words. She was talking about the spiritual aspect of it. She was talking about the emotional aspect of it. And sitar alone, you just play one chord and you are enchanted already. So this is just amazing. Mrs. Patel, right? And Azu Patel, she's called Hazu Patel. She's just wonderful music. It brings me to the other topic of she's a composer, and we had also a harpist, and she is a sound therapist. What's the difference? But she made me understand that there is a huge difference between sound therapy, music therapy, yet we are using the same organ, the brain. Can you explain me the differences between those two?
Yes. Well, I mean, there's many differences. Music therapy in general is very, it's huge. You know, we work with people from birth until death, and we work with their families past death, and we work on many different things, you know, emotional, mental, physical, cognition, academic, like all these different needs that people have. So it's very broad, and using music for that reason. But we also, the process is different. So we have an assessment phase. Even if we're seeing a person just for one session, I'll do an assessment and I'll see what their needs are, and basically how can I help them? What are their needs? What are their strengths? How am I going to be able to use music to help them meet their goals? So it's a treatment process.
Right.
Whereas I think some of these other things are maybe more of a technique and not the overall process. I know there's a process to it. You know, they have a beginning, middle, end, and all of that. But we're really looking at an assessment of the person, like creating a treatment plan. And if you're working with that person for a while, then that's going to be documented. You know, that's, you know, if you work in a hospital or something, you're going to be writing notes and charting on that, for sure.
Right.
If I see one person, it's very, I guess, you know, we're research based and we're looking for outcomes that we can see and that are objective as opposed to subjective.
Measure.
Of course, there's definitely the, you know, the anecdotal things that we can say to people and tell them how music therapy works. But we're really concerned about what is the objective evidence that it's working.
What can you measure? What are the measures in bracket can you do?
Yeah, well,
you're not always having an MRI, right? You can't
right.
always. I guess that if we had an MRI, yeah, we can measure that, but it's not always available. So what can you measure?
Yeah. So if I'm working with someone, you know, in order to calm them down or to reduce anxiety, and if they're in a hospital, it's really easy because they're already hooked up to all the machines that are measuring their respiration rate and their oxygen saturation level and their heart rate. So I can measure that. Then I help them decrease their heart rate, increase their oxygen saturation level, all of those things. But for my children with that, you know, autism, I'm measuring eye contact. I'm measuring, you know, did they respond to my greeting when I said hello? Did they say hello back? You know, we want them to do that. We want them to be able to interact with people.
Right.
You know, how many words do they say? For my folks who have, you know, that are working on walking, you know, I'm looking at their stride length and how far do they walk? How fast do they walk? Did they have to use a cane or a walker? Were they able to do it by themselves? Are they able to, you know, get from sitting to standing? How long of time does that take them? You know,
are they stable?
Yes. Yeah. Yeah. So you're looking at, yeah. But it's always helpful to have objective evidence. Not only because you can see if it's working or not, you know.
Yeah. So measurable elements, but I mean, anecdotal elements are not so much. I mean, it can be also very relevant to associate them with evidence because that's the history, and evidence also, I guess, that are there to combine with both aspects are important, isn't it? Right.
Mm-hmm.
Right.
Yeah.
So you are a researcher, doctor, also. So you did some research. What were your subject of research?
Well, my largest subject, I would say, and something that I'm really passionate about is communication. And that really started, most of my research questions come out of my practice. And so, of course, I was working a lot with kids with autism, and one of their primary needs is communication. And so that became a large body of research for me. And so then, you know, when I moved to a different location within the US, I worked a lot more with people who've had stroke. and a common thing that happens when you have a stroke is aphasia, where you're not able to speak as well. And so communication, again, was a huge factor. And so I'm looking at how can music help people communicate better. There's just so many parameters to that. But it does help, obviously. If you think about someone with aphasia, one way I help them be able to speak is through singing. So we know that oftentimes if someone can't speak, they can still sing. Like we see this with people with dementia and with Alzheimer's disease, as their body is losing the functions and they're no longer able to speak anymore, they can still sing. And so I see that with people who've had a stroke too. Oftentimes they're not able to speak, but you can still sing. And then there's lots of reasons why it works in the brain, but it also boosts your confidence, So if you're able to, if I want to tell somebody something and I have to sing it to them, that could seem a little silly, but I'm still able to communicate and get my point across, and eventually we'll work to make their singing sound more like speech. So, it takes a lot of time, but then they're able to communicate.
It's a very human aspect also. Music, as we said at the beginning, is something very human. And I guess that it reconnects with what we are. I just suspect that because I have an experience. My father was Alzheimer, and I brought him a music from an ancient period of time, like in the 30s or something. And he was aphasic at that moment. And I played that music for a while. And his eye opened and he reconnected with that memory, and he could speak some word. I was amazed because he was aphasic and he could not speak or not clearly. And the moment that we played that music, he was naming the name of this lady that was singing, and he was singing at the same time. He was joyful, and so it's like a little bit magic for me. That was the first moment that I saw that, right? So you may have been witness of so many moments like that, right? Did you?
Oh, definitely. Yeah, when I first started practicing, I'd go into, well, here in the US, we have, like nursing homes, and they will have like a unit for people with Alzheimer's disease or dementia. And I would go in and do music therapy sessions. And one of the first times that happened, a nurse had that same thing. She was like, "It's a miracle. This person hasn't talked in 4 years." And here they're talking and engaging and, coherent.
4 years.
Yeah. I mean, it does seem like a miracle, but it happens. And so I just get used to it now, but it is the first time you see it, it's astonishing. Yes.
How can you get used to that?
I know. Well, I shouldn't say I get used to it. It's still miraculous, but
of course.
But I know that it happens.
Yeah.
So.
What is the most surprising moment that you have? This is already a very big surprise, but what is the most surprising thing that you witnessed with music therapy in your career?
Oh my goodness.
Difficult to find, no?
Yeah. I can't just name just one. We'll be here forever.
Try one.
Yeah. Well, I think something that I haven't talked about a lot right now would be like the emotional impact of it. Like we were saying, music really gets to the emotions and people feel things, that you might have repressed. So people that have been through a lot of trauma, and it's very scary. And of course, that's a very delicate situation. You have to know what you're doing when you're working with somebody like that. But when they're able to release that weight that they've been carrying all those years, and they cry and they let it go, and then you can just see that they're lighter, and they've been able to connect with somebody for the first time, perhaps, and tell them their story, and really let it out, and so they don't have to hold on to it anymore. Like that's amazing, and I think it's that's something that's hard to quantify, but
but definitely you can see that it is happening. So you cannot quantify some of the aspect, I guess, that you can't quantify, but you can strongly have evidence in front of your eyes, right?
Right. Yeah.
So right now, you became president of the World Federation of Music Therapy. So it's a very fantastic achievement. Congratulations, because I think it's recent, right?
Yes, yes, about a month. Mhm.
Right. Well, fantastic. So,
Thanks.
what is the history behind that huge organization? Because I just realized that it was international, that it assembled all the countries in the world. So, how long does this association exist, and what does it do?
It originated in 1985, so we're 35 years old, I think. And serves as it is the global organization for music therapy, and so our mission is to promote music therapy, obviously, and help people get access to it. We have different branches that we work on. Have an educational branch, which helps training programs and university programs get started, as well as provide some guidance to them. We have research, of course, and ethics, and we have a journal. We really support music therapists throughout the world. So a lot of the work that we're doing is helping countries where there's not official music therapy get started, and people, are either moving to those countries that are already music therapists, or there's music therapists or people that want to become music therapists,
Right.
and so we help connect them with how you can go about doing that. One of our big struggles right now is that people have caught on to the notion that music is helpful and music is therapeutic. And so a lot of people call themselves music therapists when they don't have training. And like I've said, that can be detrimental because they can get
Yeah.
themselves into situations. Yeah, they can actually harm people, if they don't know what the science behind it.
Yeah.
So yeah, so that's something we're dealing with right now, as far as trying to help people develop the profession within their country, and educating people and all of that.
And the
Um,
journal also is publishing scientific papers also.
Yes, yep. So we do research, yes.
Yes, and the
Yeah.
journal exists since as long as the federation exists, I guess.
I think so. There was a period of time where the journal kind of went on hiatus, but it's back. So yeah, we're a very large organization, but we're still young. And if you think about, in 1985, the internet was not really a means of communication for people.
No.
So yeah, things developed very slowly when you have to have letters sent from one country to another, and communication was very slow. Now we can communicate a lot faster, so our organization is developing more rapidly, I would say, because it's easy to connect with people from all over the world, and get things done.
Yeah.
But in the beginning, it was much slower. So
Right. So, what is the future for yourself? Are you going to have new research? Do you want to write a book? What is your goal? What is your future project? What do you want to achieve that you didn't right now? Which you did a lot
um,
already, but what do you want to
yeah.
achieve more?
That's true. Yes, thank you. Yes, I mean, I have a book. I like writing. I like doing it all. And that's what makes it difficult, I guess. And not just time life balance, as a lot of people struggle with that. But right now, my passion really lies in helping the global field of music therapy. And so, really, I'm devoting a lot of time to the World Federation and music therapists. And my goal with that is really to connect people and help them. And so, connecting people in developing countries with countries that are more developed, and it's interesting because we don't want them to just take on what the developed country does. How do you develop music therapy in your own country with your own respect to your own traditions and your music healing traditions, and how people interact with music there? It's different, so that all that culture stuff behind it. Yeah, and I love traveling and meeting people and learning, how they enjoy life. And so I would like to do some more of that, of course, but
Yes.
once we can travel again.
Why not Sri Lanka? Because there is a lot. So music is something that has a big power. Are you using yourself, your piano music, when you are treating people, or you're using something that you are pre-recorded music? Did you
It's
use
most,
playing music with your patient also? Did you do that? Because you're a
yes,
pianist.
yeah, it's mostly live music. It's mostly me playing, us playing together or singing together. I would say that's a majority of it. We also do, like songwriting. I might do that to help people work through their emotions. Sometimes we listen to music and then talk about it and what it means about to the person. But generally, for me, it's really making music is what the majority of the sessions are, or moving to it, you know, or being an active participant in it.
So music is your life, doctor, right? Isn't it?
That's right. Yeah.
Wow.
Yeah.
Well, thank you very much. That's the time that we had to pass together. I'm very impressed by your journey and very touched by this work. And I guess that we will hear from your future publications. Okay, so thank you very much again, doctor. And I hope to see you soon and hear from your work in the future. So that's it for now. Have a good day. Goodbye.
Bye-bye. Thank you.
Bye-bye.